really should be to beat your friend up on this game in a friendly way, obviously, right? So as you come to the Kahoot, you should be like really excited to get in those top 5 places. Um, but yes, guys, so this is very serious, right? So do as many questions as possible. Don't rush to take the test. Don't rush to take the test. Okay? Taking the test and passing is what we all want. But right, there is no need to absolutely rush. The sooner you start the board prep, the better it is. The more continuous work you do on a daily basis, the better it is. But as we walk in the test center, one way to decrease your anxiety is by having a strong foundation, a very strong foundation. Okay. And when we walk in there, it should be a goal every time. But we don't want to, few things can get on the way. Anxiety can get on the way. Nervousness, right? So calming your mind, right? Doing your dump sheet. I made a video on YouTube on the dumping sheet. I even created a rough dumping sheet. Now, each dumping sheet should be individual to you, right? Because you may have issues with Eric's on developmental stage, right? And I may not. So that wouldn't be in my dumping sheet. I may have issues with inhibitors or inducers. So dumping sheet has to be very limited. But I made a rough dumping sheet with 43 topics. There are high yield or acronyms. They're helpful. So if you look up us on the YouTube at MP Exam Coach, you should find the information. And that dumping sheet needs to be practiced like several weeks before the test date. Because if you try to do it a few days before your test date, you might forget the information that you need to write down in your dumping sheet, right? So that's it, guys. So this was a pre-announcement, and next week we'll go over module 4. So if you started with us on module 3, so your job is to really master module 3, complete all the questions bank on module 3, and if possible, have watched the recorded portion of the module 4. So that way, when we meet, it will be more like of a questions for you, not the first time you encountering the module 4. Yes, it's a lot, and I am asking for a lot, and I know that. But I'm asking on your behalf in order to better support you. Push it, push the limits. Open the can and just push the limit as much as possible. Because your best life is just around the corner, okay? You have done so much to get here. So all we gotta do is push through now. Do it one time, do it well, and never have to do it again. Okay? All right. So if you feel that you need to talk to someone, please let me know. Okay? I don't charge none of that. Okay? So it's all in the program, is all about helping you, whether it is with questions, whether it is with anxiety, sometimes even personal stuff. I don't ask for that, but sometimes people bring that up and they ask for 1 or 2 words of advice. I can always find few minutes to meet with you. Okay, so that being said, we're about to start. Is anyone doesn't know how to play Kahoot and would like a quick information how to?
Yes, Dr. Lopez. I don't have any idea. So it's my first time here.
All right, no worries. So do you have a phone and your computer? You have 2 devices.
Yes, I have 2 devices.
Okay, so with your phone, take a picture of the QR code on the screen, on the Google screen. Or just not a picture, take a,
from the computer?
No, from your phone.
Because I just logged in directly. I just clicked on the link.
Okay, so you clicked on the link with your computer, correct?
No, with my phone.
So you need to click it your with your phone. I
So I
mean, you
should
need
turn
to
off
click
my
it with your
phone.
computer and use your phone to play.
So should I turn off my phone or should I turn off now?
So I think this time because this might take a little bit, so you just might stick around a little bit with us.
Okay.
You may be able to basically get the link that I sent you on your computer and join us on Google. With your phone, you're going to take a picture of the QR code and it should send you to this game. Once you do, all you do is enter the code and create a nickname, and then you are in. Today it's going to be a little bit longer. It's going to be about 30-40 questions, so you should be able to join us as we're starting to play now. Okay.
Okay.
And then you just ask questions if you get stuck.
Yeah. Okay.
All right, because we're about to get started, so I'm gonna write it down the code here so I remember the code.
Matt, can you mute your phone?
All right, guys. So we're about to get started now. Good
Matt,
luck, everyone.
Matt, you
Remember,
have a live mic.
okay, let's do it. Did somebody get kicked out? Okay. Okay.
Thank you.
Guys, when playing Kahoot, it doesn't allow me a big screen to do the answer. So do your best to understand what I'm trying to say with the answers. Okay, I have to improvise it a lot. Okay, perfect, right? So in this situation, you want to contact the authority. It's a crisis situation. You want to solve it that as soon as possible, right? And you do that by contacting the authorities. Now, here's the kicker, right? Be careful. The same question, if it mentions along, this is for the board. If it mentions the same exact question, or very similar, but now it mentions that you are aware of your state Tarasov principle, or you fully understand the Tarasov principle. It goes above and beyond to say that you are aware of what it is. Indirectly, it is implied that applies to your state. In that situation, contacting the person that may be at harm may be the answer. Okay? So if it goes out of the way to say you fully understand your state's Tarasov principle, or that the Tarasov principle applies to your state, or that you acknowledge the legislation, the law that imply the Tarasov principle. So indirectly, it's telling you that you are aware and applies to you. Okay, so in that case, The right answer might be to advise the person that it's at risk, and not necessarily the usual answer that I say calling the authorities or calling the nursing board. Okay? Just so you are aware that those questions could come up. And how they are different is that the question itself on the board may alert you of the Tarasoff principle applies, or you are aware of it, or you fully understand, or you already contacted your nursing board, or that applies to your state. It may not be clear cut like that. But if it goes to say the Tarasoff principle applies, it is directly cue you in to alert the possible victim. Okay? So similar question, very similar, but with possible different answer. Always understand that Kahoot does not allow me a full answer, so I have to still convey the meaning with a very limited amount of character. Right, so the PMHNP should immediately report the child abuse to CPS. So here we go. If you have a mic that's open, please close it so it doesn't give an echo. So that's the answer. Look at my mic. 1 second.
You had your microphone.
Okay, thank you for closing. So what the answer should look like, right? Should be on C, or mandating report law requires healthcare professional, including PMHNP, to report suspected child abuse to the appropriate child protective service or authority, right? So when you think about reporting, ask yourself one thing first. Have you collected enough information? Did you have a chance to collect enough information? Immediately by suspecting abuse and you have done nothing when you could have a chance to do something, it's likely not to be the right answer. So what am I talking about? If I see a suspect child and I have an opportunity to investigate further, that should be the answer, not immediately reporting. In this case, the evidence is right in front of your eyes. There is nothing else to investigate. So now your job is to report. Okay? So very similar questions can have a twist in it. So it's important that you know when the twist comes in play. Okay. So here it was a little bit confusing, right? Uh, when do you break confidentiality, right? There are exceptions of confidentiality, right? So oftentimes you say, I will break their, I do this summaries to my patients. I'm here to support you. I'm here to help you. However, there are instances in which I have to take action, right? What are those instances? If you're abusing children, elderly, immediately when there are risk factors to your health, right? You're putting yourself in dangers. Those I have to report. Okay, so that in those cases, or if someone is passed out on the ground and I cannot collect information, right? I have to take an action. So confidentiality becomes the second portion. Immediate concerns, self-harm. The question should have been more specifically with the plan, right? And that's why it may have thrown off some of you guys, and I get it. But if I have an immediate concern, then I have to report the possible self-harm. Okay.
I'll pose my question on that one.
Okay. Okay, so what's the difference between the blue and the green option? So remember, those answers, they never allow me to put a complete answer, right? I only have few characters to make up a possible answer. So it's very condensed. But if we look, respect the patient's request for confidentiality and advise on the next step versus informing the patient that uh, they will keep the information confidential. Which one would be a more comprehensive answer? Okay, so look for a more comprehensive answer, and that works well for the red option A dash. Assure the patient that confidentiality will be maintained. So that's pretty much almost hand to hand with the green option, right? So the blue option is more of a complete answer, right? It provides more to not only, hey, I'm keeping confidentiality, but here is the next step. Right? So there was a question about the previous question, and I get it that you're probably going to say that was thoughts of self-harm. Yes, you're right. On the board, it'll be more specific. It would say with plans. Just thoughts
It's
in
not
itself
enough.
may not be enough, right?
Mhm.
But depends if there is an act of self-harm, and we can go in details about that.
Yeah.
But you are right.
Okay.
It should have more solid information before reporting. Just, hey, I just don't feel like I want to wake up. It's not a reason for reporting. Okay?
Okay, thanks.
Absolutely. The question was a bit confusing. I get it there. Yeah, for sure. All right. So remember, the answers doesn't allow me the capability to give you a full answer. So I have to work with the limit characters that I have. But here is a better explanation, right? So if nobody does what they don't want to do, nobody, right? So if I say to the patient, hey, you're gonna take meds because that's best for you, they don't care. They're not gonna take it. They're gonna do what they agree with. So if the patient is resistant, don't try to convince them to take medication. You give them medication options, you give psychotherapy options, you tell them, hey, it's like a marriage. One is great, the other one is great. When you put them together, we have the dream team, right? So, and they'll come to the conclusion that psychotherapy may or may not alone be what they need. So that goes with that. All right, we have 10 seconds left. All right, so let's say this one was kind of easy, right? Now, let's say the option B there, the brown option, only said contact the victim to warn them. Would this still be the right answer?
Yes.
No.
No? Why not?
Yes. I say yes.
Okay, I think somebody said no.
Yes, I say no.
Okay, can you explain what are your rationales are?
I don't have one.
You don't have one?
No.
Okay,
No.
It's
So-
the duty to warn, right? From impending.
I do, Dr.
The question
Dallas.
did state that the patient was planning on harming others, correct?
right.
So
Didn't
therefore, you have a duty to warn others
But
or
well,
contact authorities.
not just that.
Yeah, let her finish,
It's
please.
important to contact the authorities because sometimes your possible victims don't take, they maybe they've made threats a lot of times before, they don't take them seriously. So at least if you report it, then the proper measures can be taken to investigate, how serious this matter is.
Okay.
Yeah, I understand that,
Cool.
but he said that if it only stated to warn them, I was thinking like if it only stated to warn the individual, then you have a duty to warn that
Oh, yeah.
person. Yeah.
So here's what I was trying to alert to you guys in the beginning of the conversation when we first started, right? If the question goes out of the way to say that you examine your state board of nursing, that you understand the Tarasov principle, that the Tarasov principle applies to your state. Now, the correct answer most likely is warn the possible victim. Same question. It doesn't say anything about Tarasov principle. Now, the answer is not to contact the possible victim. The answer will be either contact the authorities, contact the nursing, the board of nursing. But why? It seems so silly. It is. But because you contact the board of nursing, you fully understand if it applies to your state and they would give you possible advice on this dreamland, right? They would be right there on the phone to answer your questions, to provide all this information. This is a test. It's not real life. Okay? So are we kind of clear? If the question goes out of the way to say, I fully understand the Tarasov principle, or you examine the Tarasov principle applies to your state, or you are aware of the regulations that applies to your state, it's indirectly QUN that applies to warning the possible victim. Okay? It can be confusing, but I'm just saying that, hey, if the questions, what the Tarasov principle is a duty to warn. And it's saying that you understand the duty to warn obligation and applies to you. It's, it may not be directly saying that to you, but if it goes out of the way to put Tarasov principle as applicable, that means you have the duty to warn the possible victim.
I get
Okay?
it.
Yeah, very similar, right? The right answer can be just a gray area. Most of the time, the answer is call the authority, call the nursing board, the board of nursing. The exception to that, because that's always safe answers, can never be wrong. Alternative to that is to say, hey, as a PMHNP, you fully understand the Tarasov principle. It may not say specifically applies to you, but it's saying you understand. So hey, it's QUN that applies to you at that point. Okay. So here we go. When you hear Tarasov principle, it means duty to warn the possible individual that may be at dangers. Here you go. Next question. It says the patient does not have a specific plan, but they express a strong desire to teach them a lesson. What would you do? Perfect. We're almost there, right? The question went out of the way to put the Tarasov principle applies, or you're aware of it. In that case, you have a duty to warn the possible victim. Same question. Didn't say anything about Tarasov. Option to contact the neighbors to warn them about the delusion and potential harm. Most likely it would be the incorrect answer. Correct answer would be calling the police, calling the nurse board for assistance. Okay? Because why is that? Well, the Tarasov principle doesn't apply to every state, and the board is nationally. So if they mention the Tarasov principle, it's kind of almost, they may not say it applies to you, to your state, but it's indirectly QUN that applies to you. Okay? Obviously, they wouldn't say that because that would have been too easy, right?
But Dr. Lopez, I have a question in reference
Sure.
to the victim, the person that they want to harm. Now, what about confidentiality in that case?
There is no confidentiality in that case. So
No.
the Tarasov principle has been ruled out by the court that when someone is at risk, it trumps confidentiality.
Okay.
Confidentiality now it's a very little thing in my books, because who cares about confidentiality when somebody might be dead?
Somebody's going
Right?
to be harmed. Right. Okay.
Yeah. So in that point, I mean, we have to always think, what are the reasons why we break confidentiality? When someone is in dangers, we may break confidentiality. When the patient's in dangers, when there is a catastrophe, when the risks outweigh the confidentiality limit. We want always to respect confidentiality, but not when the risk outweighs the
Sense of
benefit.
harm. Right. Gotcha.
Yes.
Okay. That makes sense. Thank you.
Yeah, great question, by the way. Yes, absolutely. It's always a wish-washy and it's never clear answer, unfortunately. How many times I mentioned that we need to know pico by the letter. And here is a possible reason why. You need to know age by the letter. What it means. Okay, so here is a clear example, right, of few things that we discussed in details, and we are missing some of the clear-cut answers that we should not. PICO, problem or patient, right? Intervention, comparison, outcome, T for time. Now, CAGE, the same principle applies. These are very, very high yield acronyms that you need to know in detail. Kind of knowing will not cut the bill because they'll put all letters, there are similars, and they'll confuse you, right? So the P can be patient or population or problem, right? Intervention, comparison, outcome, and time frame. Okay. So if you got this question incorrect, please write it down on the side piece of paper that you need to know CAGE, what CAGE means by the letter, not kind of knowing, and you need to know PICO, what it means by the letter. At minimum, right? Because those two questions are likely to be on your board. Very common. Okay, so the patient intervention, comparison, outcome, time frame. Hold on a second, guys. Let's just see here the answer here. So the PICO indeed stands for problem, intervention, comparison, outcome, and time frame. So time frame, right? Is an acronym commonly used in evidence-based practice and research to structure the research question. So what is the problem here? So the problem refers to the specific clinical issue or questions being asked. In this case, PTSD. The intervention, what are we going to do? Option A, medication B, right? And then we compare, right? What we're going to do, the intervention can be psychotherapy versus medication. Then we're going to compare to the alternative of the interventions. And then we look at the outcome, right? And the results of interest or time frame. So be careful, okay? So actually lost my thought process. I think did I cue in incorrectly this question? I think it was
It had
B
the
was the
word
right answer.
person or patient instead of problem.
Okay.
Yeah,
Yeah, so problem or patient or population often falls into the P. It depends how you use it, a variation of it, but it's very close. It's always the problem, the patient, or population. All right, so I get to put A and B, the same thing, right? So if you answer B, you are correct too. So the level of evidence. What if the question said exactly the same thing instead of saying a study, several studies? What level of evidence would that be?
Level 1.
Level 1, right? So what's the name of level 1? What are the two studies that falls into level 1?
Meta-analysis,
a meta-analysis.
a systemic,
Perfect. Meta-analysis or systemic
Systemic,
system
yeah.
review analysis, right? So they're actually very, very similar what they look like. But for us, for the task, we're not researchers, indeed, right? Not downright researchers. Basically, we are gathering several articles that have been validated as a level 1, right? And the double blinded, we'll put them all together, we run through a machine, we give numbers that validates the results, and then we create one article that says, hey, we run 35 articles, put all the numbers in there, now we calculated these numbers and come up with these evidence. So that is meta-analysis or systemic review analysis, okay? And that is the strongest level of review we want to use. All right, so I should have said really level 2, right? So why it is not, the answer here is inappropriate, right? It should said it's a
I didn't see level 2.
right. So that said that I put it in incorrectly as the answer,
Okay.
Okay.
right? Should have been level 2.
Yeah, I kept looking and I'm saying no.
Yeah. So you are right. I keyed in incorrectly. The answer doesn't apply, right? Should have been level 2. We look at one research, double-blinded, validated with comparisons between option A and option B, double-blinded or blind studies, RTC, level 2. Several researchers together, compiled, or either be level 1 systemic or meta-analysis. Okay, so this is my fault. The answer should have been B, however, level 2. Okay. So that, as I have it here, as a level 2, as the answer. Okay, here we go. So it says several research studies when in doubt, cut some of the possible incorrect answers. Okay, perfect. Yes. So not that the statistical evidence or significance is not important, but the better answer will be the quality and the strength of the research design and methodologies, right? So who can tell me what is the level of significance? What does it mean to a research? Right? If I say level of significance is, super high, it means that the result found is applicable to the general population that the study was implied to. Okay, was higher level that it wasn't by chance. Better said, it wasn't. It was actually because of the implementation. When you're looking for evidence, what's the first thing you do? Remember, I'm only allowed to put so many characters as I answer, okay? Yeah, if you're looking for evidence, you do a literature search. All right, Rash Shield has 13 answers correct in a row. So there you go, you're killing it, right? So the initial step in utilize evidence-based practice guideline is to conduct a literature search to identify relevant articles. Oftentimes on tests, answer A would have been something like conduct the expert in the field, the cardiologist, or the master in psychiatry that is very specialized on substance use abuse, substance use disorder, because it's trying to lead you in the wrong path. That is far cry anyone that use personal experience as the basis to solve a problem is a far cry answer compared to research. And doesn't matter what expert are we talking about. Research is always beats the expert opinion. We only use expert opinions when there is no research available. For example, COVID, we used a lot of expert opinions. There wasn't research enough about COVID, right? So we had to rely on the expertise. Now we rely more on the research than expertise. Okay. But expertise always sounds good. So All right, we have 7 minutes left. 7 seconds, 5 seconds, and we are done. Pick your answer. All right, so to begin with, research in general doesn't guarantee nothing, right? I always get dinged on that because I say, I used to say what I used to say, proves, research doesn't prove nothing, right? It suggests or strongly suggests. Research is not a proof that it will happen. It just strongly suggests that we should do X and Y and Z. Never prove. I got hit on that several times by saying prove, right? So learn it. So always strongly suggests or indicates or validates these findings. So if you're ever looking for a good guideline for manic or hypomanic, look at the Canadian clinical practical guideline. Is excellent. That's what I use for my practice all the time. It's really good. Remember, I'm not allowed to put a complete answer, so I'm trying to make an answer that has enough characters and that makes sense for a possible answer. Okay, so why not the green option? Do a literature search of various treatment regardless of their evidence. Do I care about the evidence? Yes, right? If I have a bunch of garbage in my hand, then my answer will be garbage, right? So the evidence is super important. A stronger answer is search the most relevant clinical practice guidelines by a reputable source, right? So here it didn't allow me to put a full answer, but here is what it would have been the correct answer, right? So as I mentioned, the Canadian clinical practice guideline for bipolar manic is excellent. It's free too. All right, so why is the green option not suitable, right? So if I have a Hispanic client, then I'll say to him, hey, let me do some training on your culture, and then you come back next week, right? Versus do a culture background and beliefs and incorporate this information in their care, right? I think would have been too late to go find the training, but more of a, hey, I have to do care within your beliefs and your culture. That's the summary. Again, it doesn't allow me to completely put a full answer in that, right? The point here is only one: providing culturally sensitive care. We give you several examples of what that looks like in the past. Culturally sensitive care does not mean scientifically based care, right? We get a lot of lost questions or points on that because we think, okay, the right answer is to provide antibiotic or to start you on a medication or start you on the therapy. Remember, if it's culturally sensitive, the right answer is what's right for the patient, what the patient thinks is right in their culture, and can be sometimes even borderline absurd, right? You have to go with the resistance. What is normal for you in your culture? Help me understand. Teach me. Tell me what's like to be you in your culture. What is acceptable for you? These are the possible answers. Rather than, here's your antibiotic, your PHQ-9 suggests 19, which suggests likelihood of depressions. You present with depression, here's your Zoloft, right? That would be an incorrect answer. Perfect. If it's asking for least restrictive option, it's always looking for what can I do with the patient that still allows the patient the capability to move and do things freely. And that's almost never the case of an inpatient admission, right? So usually it's an outpatient settings, trying to manage crisis stabilization unit, right? Before considering an inpatient admission. What do you do anytime you hear stigma in the community? That is part of our module 5 question, right? I think we went over this a little bit, but module 5 covers a lot of that. Okay, glad no one picked the green option there. We can't provide lawsuits on anybody because they don't believe in mental health. But anytime you hear stigma, it translates to education. Anytime you want to decrease stigma, you have to join a organization, other people. You have to create the movement, right? You have to pass it on your education. And you do that by reaching most people possible. You do that by joining ANA, where you are able to advocate for mental health as a group or other organizations. I'm not just endorsing ANA, but point is, together, we are able to move mountains. Alone, any one of us would fail in any big accomplishment. Okay.
Dr. Thales,
Yes.
what if
Hi.
it says community organizations or it states or it states patients of the clinic?
So then you would look for the one that reaches most people,
Okay.
right? If it's just a community, I'm reaching maybe 10,000 people. Now, if I go to the news and they talk on the morning show of the signs and symptoms of depression, I might be reaching 200,000 people.
But if it say community organization,
Yeah, still,
mhm,
still you want to reach the most people. When it's
okay.
about stigma, it's about education. And
And
you
that
want to
would
do the
probably that would be more than just your patients, right?
absolutely,
Yeah.
absolutely. Yeah, absolutely. It's always stigma in mental health means education and advocacy. And
Yes.
then you have to reach most people through whether it's community service compared to advocating for suicidal ideations decrease in the high school versus in a community, or going through the news, radio, whatever you can reach most people. So that is for the community, not for the patient. Absolutely.
Thank you.
This applies to the principle of just culture. What is just culture, right? Why is this important? This is likely to be in your board, the just culture class. Right? Something that we apply in nursing, psychiatry, in general. All right, so that is we want to do a multidisciplinary team and kind of find out what is going on. We don't want to also put the nurse on blast, right? Why did you do this? We look at the system, how the system failed you. However, if the nurse, the provider, the doctor is clearly going out of the way by not following the policy, then maybe some repercussions there. Okay, but always the first look is what the system did or didn't have in place, where we missed something that we could have prevented, rather than saying you did this, you are irresponsible, you cannot practice, right? That is the principle of just culture. We don't just say, hey, you're good to go, but we try to address both ways. Just culture. So hopefully everyone gets this answer right. We have about 22 seconds here left. What is the principle of just culture? Okay, perfect, right? So everyone here nearly got it correct. So just culture is openly talking about the mistake, not hiding it, and looking at the system, how the system didn't help you or what was missing that we didn't get this circumstance correct. Was it because you had 5 patients waiting for you or you had 5 meds in your hand? How can we make this better rather than blaming the person specifically, okay? So it's quality improvement. Remember what we do in quality improvement? Keyword is quality improvement. Okay. So let's take a look here on the answer for a better explanation. So when you hear quality improvement, right, you want to do a multidisciplinary team to assess the current state of care, right? Oftentimes that's done through chart reviews as well. But if you hear root cause analysis, it's not in nursing, we have the tendency to look at root cause analysis when something extremely bad happened. But generally speaking, it doesn't have to be there horrible. The delay of patient care in AD arriving to the psychiatry alone can be a root cause analysis to identify the issues that are preventing patients from moving from the ED to psychiatry. Not necessarily somebody died and it's a bad outcome. We will always have a root cause analysis, but it can be just identifying issues in the system, the quality improvement, okay? Quality improvement also has to do a lot with chart reviews. Now, remember, the order is important. Stakeholders and various prospective stakeholders, and also the feedback of who's involved in the quality improvement. And we talk about this on module 5 in excruciating details, because not only it's important the quality improvement, but to whom you go first, the order that it applies. Don't be tired. Don't be tired. Get off the internet, please. Okay, quality improvement, we want to get the information and identifying the areas of improvement, right? Often related to a chart review, can be also root cause analysis, right? Collaboration is also super important. Okay, perfect. Let's take a look on the answer here. Implementing standardized depression screening tool for all patients during intake assessment is an example of quality improvement initiative. Focus on the patient care and outcome, right? Aims at identifying and address depression patients early, potentially leading to improvement in mental health outcomes. So, well, we have a few more questions. So again, we're looking for quality improvement. How can it be achieved? Remember, quality improvement has to do a lot with charting. We look at the patient chart. Okay? Of those that have gone through deployment. So more specifically, retrospective chart review. That's the key word. Okay, if you hear quality improvement, retrospective chart review, super high yield. Okay, so implement a regular audit process to review the patient's assessment documentation, providing feedback to staff is a clear example of quality improvement. That could come in a simple form as retrospective chart review. How do we do quality improvement initiative? Okay, we do a retrospective chart audit, right? We look at those charts, look at what happened, put it all together in numbers in a nice format, and analyze historical data on seclusion and restraint incident to identify the patterns that are most appropriate first step, right? So here you have it. That's the last question of the day. Same question in a slightly different format, right? So quality improvement will do two things mainly. What are they? We create a policy, do we identify those that are harmful to the system? We improve the meds guidelines, or we do a root cause analysis to identify contributing factors. Perfect, right? So quality improvement, retrospective chart review, root analysis, high yield, okay? And it's like almost sure that you'll get a question on quality improvement. And there is a way of doing quality improvement. Who do we go first? What's the system? And all that we discussed on our module 5. It's coming up. TM got the third place there. Ready got the second place. And today's event winner is Jeanette. Jeanette is on fire. All of you guys did super good. We have in the fifth course, I missed it. So pretty much this concludes today's event. TM, Rash, and Jeanette, you guys earned $100 for Jeanette's course with us. Send me an email. I will go ahead and take a picture of this now. So that way, if we have other courses that are not enrolled and you'd like to partake, you have $100 for that. So there you have it. Let me take a picture of this. Okay. Now, this is pretty much concludes today's event. Now, go ahead and take a break. And I would like to, there's no more cheating for the rest of the day, right? So please, if you, that day was enough for you, you are more than welcome to go rest for the rest of the night. Or you can stick around and ask any questions about anything or anything that's in your mind or anything that can help you. Now is the time to ask some questions. So let's take a 7 minutes break and come back at 7:40 if you like to, but there is no more teaching. So 7:40 we'll come back and discuss anything that's in your mind or anything that I can possibly help you with. Okay. So, and kind of Hebo, kind of want to see you if possible after everybody else. If you can't come back, I would appreciate it. Nothing bad. I just want to ask you a few questions. Okay.